My name is Ken Cho. I've been a GP for nearly 45 years. And during all this year, I have been seeing some very tragic deaths due to pancreatic cancer. As a GP, we don't normally see that many pancreatic ulcers during our practice. I myself see at best 2 a year. So our experience is pretty limited in that regard.
When my dad was about 58, he was diagnosed with pancreatic cancer. He'd been unwell for about a year or so, had very bad back pain, and the doctor had sent him off to have physiotherapy for it, but he hadn't got any relief from it. So, but nothing was investigated further until he became very ill.
It was originally thought that I had diverticulitis. The pain continued and he said, well, you better present to hospital. And they kept me there for probably about 6 hours and discharged me. And I went back to the specialist and he said, oh, well, you know, just don't drink alcohol. Just carry on as normal, really, and we'll do another scan in 3 months.
Well, unfortunately, the initial tests aren't very conclusive, and that's one of the problems with pancreatic cancer. You can't see your pancreas, you can't feel your pancreas, and so often people present fairly late.
He was just having a bit of indigestion and perhaps eating a lot of quickies, you know, and he said, then just one day he said, oh, look, I don't feel too crash hot, I'll go to the doctor. And I said to him, ask him about your colour, because I felt he was going slightly jaundiced.
The first indications that I got was a lack of appetite and a loss of weight, and started to go jaundiced.
My backache, my stomach cramps, things like that. I put down to menopause, the job I was doing, and then I started getting really just feeling nauseous all the time. And I woke up one morning and my other half said to me, you're a bit yellow there. By the time I got to the doctor, and I saw four doctors who couldn't work out what was wrong, had an ultrasound a week before I was told that I had pancreatic cancer, and the 5th doctor took one look at me and said, you've either got stones or you've got cancer, and I hope it's stones.
Often these patients will go seek other opinions, and by the time they find somebody that is able to deal with them, the cancer has advanced, and sometimes it takes 3 to 6 months to do that.
Eventually I went to the doctor and I told the doctor, I said, look, you know, I've got these horrible pains. Could it be gallstones? Because I had similar pains in the past and I already had my gallstone removed. So I thought, you know, you can't have gallstones again. But my doctor says that you can have gallstones many times.
The pain that we recognise as part of the pancreatic cancer situation is the pain of tumour growing in the pancreas, invading into the nerves of the pancreas and to the nerves at the back of the abdomen. This is the dull pain, persisting pain, doesn't go away, keeps the patient awake at night and passes through to the back. Some patients present with diabetes initially, and if this can precede the onset of the cancer by sometimes a year or so, and so recognising that if in type 2 diabetes might be associated with a tumour of the pancreas, unless there are other obvious reasons why the patient's diabetic, then I think exploring the association between pancreatic cancer and the onset of diabetes is quite an important issue.
One of the difficulties we face, even as specialists in the pancreatic field, is deciding what we need to do with somebody with indirect signs of pancreatic cancer, subtle signs, and we've all heard of them, things like the double duct sign, or the classic is the cyst. Whilst we get lots of cysts in livers and kidneys, there's really very, very rare instances of there being a simple cyst in the pancreas. In most instances, unless it's associated with pancreatitis, the cyst should be considered to be a pre-malignant lesion until proven otherwise, either through a combination of imaging techniques or, in some instances, resection or biopsy.
Generally speaking, I'll have a patient referred to me from a general practitioner or from a surgeon who's presented with some discomfort, or they've become jaundiced and their GP's done some blood tests, confirmed that the patient's liver tests are abnormal, and then they'll come to see me. They may or may not have already had some imaging tests with a CT scan or an ultrasound, and that'll often show a lump in the pancreas, but often usually that's not enough to really make the diagnosis. It can be suspicious, but then we often have to do more tests to try and see whether indeed it is a pancreatic cancer or something else.